Hi all, welcome to the final video in our series on development and health, and in today's video we're going to be looking at primary healthcare. Now, to start us off, what is primary healthcare and why is it something that we seek to implement? Now, first, dealing with the why is a little bit easier to deal with first here. So we need to acknowledge that there are many developing nations around the world that can't afford elaborate, intricate healthcare systems. Um, when these healthcare systems are present, they tend to be in centralised urban areas, and you really don't have much healthcare at all in more isolated rural areas. Now, what primary healthcare is a basic set of healthcare strategies that are aimed at dealing with common healthcare issues among a whole population and a whole nation. Now, the strategies need to be appropriate in terms of their use of technology, and they need to be reasonably simple and affordable to use. And I apologise if you see somebody else on the screen right now, as my boy is walking around. So, do you want to sit and help Daddy make his video? Okay, you just sit there, okay? Okay, so apologies for the extra today, guys. First, what are some of the common things that we do? Just sit quietly, buddy, okay? So you listen carefully and you'll hear what it's about, okay? So, what are some of the areas that primary healthcare is applied to? First, we've got food and nutrition. Now, approximately two-thirds of under fives globally are malnourished. Now, primary healthcare looks at trying to provide adequate, balanced diet for everybody. And, it does this through just various programs where you just go in and try and meet basic nutritional needs. Next, water and sanitation. Now, there is a lack of safe water is related to more or less 80% of all disease globally. Primary healthcare is then aimed at looking at how can we provide access to both clean water and sufficient sanitation for everybody. Disease control, again, approximately 5 million children die and another 5 million are disabled every single year by common childhood illnesses, things like the measles. Primary healthcare looks at trying to provide immunisation where you can and treatment for common diseases where they're not something that you can immunise against. Looking at maternal and child health, over 275,000 mothers every year die during childbirth, and 5.4 million children died before the age of 5 in 2017. The primary healthcare looks at trying to provide trained birth attendants, promote family planning, and to monitor family health as you've got young children to ensure these things don't happen. Now, if we talk about essential drug use, approximately 50% of global health budgets are spent on providing drugs and medication. Primary healthcare looks at trying to restrict the types of drugs that are being provided in developing nations to 200 essential drugs that are extremely important. Preferably looking at manufacturing those drugs locally and trying to ensure that they're available at an affordable price. Curative care, we're talking about the millions of cases of things like acute diarrhea that kill that kill people, particularly young children, every single year. And primary healthcare again looks at trying to provide trained local health workers that can diagnose these reasonably straightforward conditions and offer some straightforward common treatments, and they can treat minor injuries as well. Now, the last two we've got here is looking at traditional medicine and health education. So with traditional medicine, we're talking about trying to get traditional birth attendants who are already responsible for delivering the huge majority of children globally. And primary healthcare looks at enlisting these traditional healers and giving them additional training to make sure that they can continue to do the work that they do, but be slightly more effective at it. And with health education, we're looking at trying to prevent illnesses spreading by changing societal and personal habits. So primary healthcare is looking at going in and educating people on some of the causes of ill health and how to ensure good health. And it's things like washing hands and separating areas where people defecate and where they draw drinking water from and things like that. Now, there's only kind of two other things that we look at, and these are areas where you're expected to expand this kind of stuff out with your notes. Now, primary healthcare in Africa, currently there's four main areas that are looked at. Now, people are trying to replace largely hospital and clinic-based healthcare, where people go to healthcare, with models that bring healthcare to people. So trying to have more, simply put, more house calls, and trying to put doctors in the more rurally isolated areas. Trying to provide overall more information, more education, and it goes back to this kind of how does disease spread side of things, and it looks at how are we going to make people aware of things they can do to reduce the instances of disease. Taking non-medical administrative tasks and things like that away from medical specialists, doctors, nurses, etc., and allowing them to focus on actually providing critical care to people, and training local people to deliver education in their communities that focus on this prevention of disease and ill health. So it really is focusing on enhance education, alter how we deliver healthcare so that it's being delivered more effectively, and work on making sure that the people who are delivering healthcare are able to do it more effectively. And a smaller focus, if we think about Ethiopia, for example, Ethiopia over the past number of decades had really struggled with healthcare. It's went from a position where it's had huge need for healthcare, but basically had no healthcare available. Now it's focused on three main areas as part of its healthcare strategy. It's focused on providing 40,000 health extension, that should say workers, so apologies for the typo. And these people are local people, generally women, who are trained to go into their own communities and provide the kind of simple bits of healthcare that don't require somebody that's a trained doctor to administer. Using all the stuff we've been talking about with primary healthcare, but building more health centres in more isolated areas so that they can work with the people administering primary healthcare, and they're there to address the complex medical issues that people like the health extension workers, can't deal with. And Ethiopia's tried to drive private investment in its hospitals, and this is to try and increase the overall quality of the hospitals and try and provide a better standard of healthcare. Now that wraps up what we're going to be looking at today, guys, in terms of primary healthcare. It's a bit of a shorter video today, and apologies for the added extra. Hang on. Do you want to say hello? No. Somebody's a bit tired and grumpy. But yeah, so apologies for the kind of slight interruptions, guys, and apologies that this video's up a little later than I'd intended it to. But this wraps up our development and health topic. And as I say, with the primary healthcare strategies in Africa and in Ethiopia, we'll discuss that a wee bit more in class, and you'll obviously enhance this with some in-class research and notes. And until next time, guys, I will catch up with you all later. Bye.